Welcome to the Reprofiles, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Reprofiles.
Infertility, injustice, and all things nobody warned you about.
Welcome back to the Reprofiles, guys. We're back to our regularly scheduled episodes. I am Elizabeth Lee, nurse, patient advocate, and somebody who believes that men also deserve honest, evidence-based conversations about their health.
Yeah, and I'm Anne Marie. I'm also a nurse, patient advocate, and someone who believes men deserve honest, evidence-driven conversation. We are jumping
now
into
that
men's.
we're on the same page,
Yeah. We're going to jump into Men's Health Month and talk about things that men face but rarely say out loud because our guys they don't talk very much most of the time. And now that it's Movember,
Movember.
Men's Health Month, we want to talk about our guys.
Yeah, I mean, I think everything from obviously our perspective, our lens is the fertility one, but it really is heart health, metabolic health, mental health, hormonal health, fertility, identity. It's the whole landscape, right? And normalizing conversation around all of those different facets of men's health.
Yeah. So if you're a man listening, this episode is a permission slip to take yourself seriously. If you're a partner, a friend, a loved one, we're giving you kind of the tools to start meaningful health conversations.
Yeah, absolutely. And that's really at the end of the day, you know, if you can more easily start a conversation, then we've done our job. So let's get started. Give us some
Yeah.
facts
Yeah.
on heart
All right.
disease because that's
Yeah, let's talk about the heart disease. It's still the leading cause of death for men in the United States. The CDC shows that from 2017 to 2020, about 50, a little bit more than 50% of men had high blood pressure. That's more than half. So, we need to get that under control, guys. That's important.
absolutely. My husband woke me up in the middle of the night one night in I don't even know what year it is now. I don't know, maybe 5 years ago. And he was having what looked like classic symptoms of a heart attack. So a
Jeez.
heart attack, myocardial infarction, right? You see, a lot of times you'll see the person will become pale, they'll start sweating, they'll have arm and or, chest pain. And all of those things were true. And yet it didn't entirely present like, I mean, I had my first, we've talked about this on the show before. My first job was as a heart nurse. So I'm like, this is not really presenting like I would expect. The lifetime risk of coronary heart disease at age 40 is around 49% for men. And that's compared to just over 31% for women. And so my husband was, this 40-year-old guy. He was right around 40 and was relatively in shape. And, it was actually not a heart attack. It presented just like one, but he had, interesting story, he had scarlet fever as a kid. And he has psoriasis. I think I'm just like giving his whole medical history. So HIPAA release, thank you. But he's had some autoimmune issues occur that are in line with that history of scarlet fever. And so when he had, now this has happened twice, these they look like a heart attack, but it's not. It's actually pericarditis or inflammation of the pericardium, that sac that surrounds the heart. And what it is his body gets exposed to stress and it causes it to attack the pericardium. So men, I mean, they face, and this was like a little bit of an odd one, but overall men face higher cardiovascular risk early and more often than women do.
And many men, they delay seeing a doctor until, something becomes really severe. And, we probably hear this all the time. And I'm going to tell you a story of my personal experience, but we hear this all the time. Men are like, oh, I don't want to bother anybody. I don't feel sick enough. It's probably nothing. And, I have two stories. One, my father. My father always signed himself out AMA whenever he went to the hospital. He just never liked being in hospitals. He hated it. He had kidney stones and, they did surgery and he was like, "Yep, where's the paper? I'm going to sign it." And he would do that all the time. He was notorious for doing that. So then I have the opposite with my husband. He likes to see the doctor as soon as he sneezes or if he has a little sore throat. He's like, "I got to go to the doctor. I got to go to urgent care." And that's the joke in my house is that he always has to go to urgent care. He's probably listening to me right now and is like, "That's not me," but it is. It's
We
true.
totally
He
did
is
set
one
him
of
up
those.
earlier. I asked him to be a guest, so if you would like to come defend yourself, Miss Anne Marie,
Yeah.
let us know. But, you know, it's funny because that night, the very first night he had this like heart attack, he ended up, believe it or not, I probably sound like the worst wife ever, but he convinced me to just go back to sleep because, if he had like that little bit of diaphoretic, it just looked kind of, but then I checked his blood pressure, I listened to his heart, everything was seemingly okay. But then in the morning, because he's like, no, 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 like go to sleep. And if it comes back, like I don't want to bother anybody. If it comes back, I promise I'll wake you up. So in the morning, he still had this like faint pain. And as we know, ignoring symptoms does not make them disappear. And in his case, it raised his chances of a cardiac event. And prevention looks pretty simple on paper. And much like we talk about with women's health, there's a lot of just things that are education based things. Like women, did you know that, your eggs become really a lot harder to make a genetically normal embryo and a healthy pregnancy after 35? It's start decline. A lot of women don't know that. I think most men aren't told some of these things, right? Know your blood pressure. So after my husband had his couple situations, it was like, okay, now you need to start taking your blood pressure. You need to kind of be aware of the symptoms and identify them before you kind of talk yourself out of it. I made him go to his PCP and get like basic stuff, screening for diabetes, screening for lipids, cholesterol, triglycerides, things like that. Guys, it's really critical to the more weight you keep around your abdomen, the higher cardiac risk. And so maintaining a healthy weight, limiting alcohol, not smoking, managing stress, those are all pretty basic steps that you can do just to be aware, right? Know your blood pressure, know your numbers, so to speak, and then really taking accountability for what goes in your body, which is the harder part, I think, especially nowadays.
Yeah. Yeah, definitely. And this is where the reproductive health intersects with everything, the testosterone, insulin resistance, inflammation, cardiovascular risk. They all kind of sit on the same axis. So if testosterone is low, you'll often see an increase in that visceral fat, around the belly and all of that stuff, reduced muscle mass, higher inflammation, and a metabolic disruption. So these are important kind of
Yeah,
things.
and those are all hormone-based things, and I think, we obviously see how metabolic disruption affects sperm quality. So when we're seeing, men of reproductive age, so to speak, I mean, that's a much broader window for men than it is for women. But often there are these disturbances are, later in life, maybe when a man may not be even, he might not have any interest whatsoever in his sperm quality, but cardiovascular health and fertility aren't really all that separate. And so the disruption of those hormones affecting sperm quality then has sort of like these downstream effects on your overall cardiovascular health. And that's similar with women, right? Because we used to their ovaries and their lifespan were around, they had about the same lifespan. So, a woman and her ovaries had about the same lifespan. Now, because we have increased our lifespan as women, we live to be 80 now and not 40. Our ovaries are toast by 45, right? And so, all of
Mhm.
that drop off in hormones again, we're talking about men tonight, but cardiovascular health and fertility are really not separate because these hormones are all, I remember learning hormones in nursing school and I'll never forget this idea of a messaging system, and certain things have to go certain places either to start a process, advance a process, or complete a process as hormones. And so when you think about it in that complex of a way, it does make sense how deeply connected they are. And I think it's just not talked about.
Yeah. And the earlier men get engaged with prevention, the better their long-term cardiac health are and better reproductive outcomes.
Yeah, absolutely. And that's, to take a slight side path for a second, I think that's what a lot of us advocates in health professionals in the field are feeling very frustrated about right now with the current political landscape surrounding our healthcare system because what we're doing by letting the ACA subsidies expire is we're effectively people will not get healthcare, right? So the ACA brought healthcare to like we were like at 95%, I think, of the US population had some form of health insurance, which was like wildly different. I remember there was a time where I didn't qualify for a number of things because of a quote pre-existing condition. Like being born is a pre-existing condition. But anyway, I digress. I digress. But so let's talk about diabetes and weight. Let's start there because men are more likely to develop type 2 diabetes at a lower weight than women because again those visceral fat stores, that central belly fat is biologically active and fuels that insulin resistance that you see. So a lot of times even like in your PCOS population, that extra central belly fat is often a key to breaking their insulin resistance so that you can improve their ovarian health. But diabetes as a whole, that's why guys are often going to have a higher risk at a lower weight because the weight that they do have is fueling that insulin resistance.
Yeah, that diabetes prevalence overall is about a little bit more than 11% of the US population. That was in 2021. Among adults, men had a higher diagnosis rate of about 11.6% compared to 8.8% for women.
So interesting, right? I mean, it's fascinating given that so much research has only been exclusively done with the male population, and yet
Mhm.
it really is it's fascinating how at the end of the day, yeah, diabetes is hitting the male population at like 3% or more higher. That's significant. And insulin resistance and low testosterone feed into one another. So that's the key for men and for women. I personally had like almost non-existent testosterone. And when I corrected that, it was very surprising how a lot of my metabolic syndrome type issues, a lot of like stored like a fat on the back of the neck, just some of those metabolic symptoms like when I corrected the testosterone, it corrected the other. And for guys, both insulin resistance and low testosterone affect sperm quality. And we see this in clinic every day, day after day. Energy drops, libido drops, sperm count drops, right? I mean, you've heard this story a million times,
Yeah.
unfortunately.
So, yeah. I mean, so, diet, exercising, just movement, stress management, sleep hygiene. These things matter than more than what most people realize. But let's talk about, continuing on our weight, but talk about weight stigma. So
Yeah.
men don't get a pass on body image struggles. They just hide them better. And, there's always that the magazines and the thin women and how they cut out parts so like, oh, look how thin that person is and stuff. But men actually do have body image struggles as well. They don't want to say it, right? They don't want to say it out loud. And they don't want to admit to people. Why? Because we always are like, no, men can't talk about their feelings or how they're experiencing those types of things. So, they do hide them better.
Yeah, absolutely. No, and partners play such a pivotal role because my husband is a very good gene stock, right? His father, his brother, his grandfather, they all were like rail thin, just totally he could eat anything and never gain a pound. And so for like the first, I don't know, maybe 10 years of our relationship, something like that, it was just like this joke because he could just eat whatever he wanted and not gain any weight. And then he neared 40, right? Hormones start shifting. He starts gaining weight, right? And I was always the one that suffered with weight issues. So it was like a strange juxtaposition when all of a sudden he was having like these not body, but maybe, yeah, like because I think it is too, like, we call it dad bod, right? So, partners play a role here because a supportive way and the way that I always have dealt with it over the years with my partner is like, let's just focus on feeling healthier together. Like, it's an invitation, it's not an accusation. Understanding that weight management is really hard. It's just really hard. There wouldn't be decades and decades of diet pills and all the things if it weren't so hard. So focusing on the let's be healthier I think is the key as opposed to like how you don't look good. But again, focusing on
Yeah.
supportive, I think.
Yeah, I think, definitely the only times that whenever I've lost weight and my husband has lost weight, it's when we do it together because,
Yeah.
we don't want to be, no one wants to be the only one on a restrictive diet. Like, you can have steak and I'm over here eating a salad, or like it's all vegetables, but you're getting this yummy
Yeah.
dinner over there and I want some of that,
I
but
forgot
it
about those
really,
days. We used to go through that, like, we
yeah,
would go on keto, and it was like, "Well, I'm only doing it if you're doing it because 'cause I'm not, like" yeah, I'm not gonna eat steak and eggs, like, constantly if you're eating bread and all the things, right? And I will own that I am a proud product of GLP-1s. They have changed my life. I struggled with my weight my entire life, and they have been transformational. I'm now 3 years this month having kept 100 pounds off. And I had never done that before. I had
that's awesome.
lost and gained 100 pounds a number of times, but I couldn't keep it off. And so, but understanding, I think, again, that focusing on how do we feel better? Because at the end of the day, like for me, I really it was so much about feeling better. And when I focused on that as opposed to what size clothing or whatever, a number on a scale, it just became about like, wow, I feel better.
Yeah, definitely. Elizabeth, I did not know that about
You
you
didn't?
and the 100 pounds, and I did not. That's amazing. That's awesome. I took some I did some injections, Manjaro a few years ago. I loved it. I loved being on it because one of my problems is that I overeat. It's just a thing.
Same.
It's very difficult. And I did keto. Before that I did keto and that was probably the best diet that I've ever been on. I did lose weight on keto, but like you said, it was hard because
It
my
is.
family was eating like bread and pizza and on Fridays and you know, throughout the week, they could have sandwiches and thing you're just like, "Well, I
Yeah.
can't have that." And I can make yeah, you can change your recipes to fit yourself, but it was just really hard when no one else in the family was doing
Yeah.
it.
Yeah.
So it really is definitely coming together, doing it together. My husband and we're trying to do Mediterranean right now together, and we actually are like no chips in the house, nothing like that. Both of our kids are older and they're out of the house. Well, I got one that's still living here, but she's an adult, so we don't buy food for her, but they're both kind of like at the point where like, "Oh, what do you want as a snack?" No, that's not happening anymore. So if it's not in the house, it's not being
Yeah.
eaten by either one of us. And that is truly
Yeah.
helping for sure.
Yeah. Yep.
Uh, As for fertility professionals, metabolic health, it has to be part of every male assessment. Men need clarity. They want clarity. They want to understand the link between metabolic health and reproductive outcomes because if they know how they can help the situation, because we always say this too, fertility is not just a women's thing. It's a both thing. It's men and women. So I think that, understanding this gives them a roadmap and gives them understanding of like, hey, how can I help? What can I do to improve things? And they can do it together as a
Yeah, yeah, yeah. Well, and reminding them like change is possible. You don't need perfection. You just need direction. And a lot of times patients come into our clinics, they're very frustrated. They want answers. And so, again, you just a lot of times have to give them some direction.
yeah, yeah. So Elizabeth, we touched on this a little bit earlier, and I think we should focus a little bit more going into the mental health. It's a
Yeah.
part that men rarely talk about. So, there are reports out there that men die in the US, by suicide at a 4 times the rate of women. And when I saw that, that was actually kind of surprising to me, to be honest. I didn't realize it was that much more.
Stark of a difference. Yeah. 4 times
Mhm.
as we prepared for this episode, I too was struck by that data point. I had no idea it was at that rate. The Anxiety and Depression Association of America notes that 1 in 10 men experience depression and anxiety, yet they're far less likely to seek care. And so worry and anxiety over time increase the risks of those things we talked about earlier, like heart disease and stroke and diabetes. So
Mhm.
recognizing that that is an alarming statistic that men in the US die at 4 times the rate, die of suicide at 4 times the rate of women. That is an alarming statistic. And I wonder how much, I don't know that we really paired any thoughts on this, but it's just an open question, is how much the rate, right? We know that men serve in the military at a higher rate than those women who serve in the military. So I would be curious to know what the link is there, if there is one, or what
Mhm.
the relationship is, because I think when I think of, men dying of suicide, I think a lot about our veterans. And we, just celebrated Veterans Day yesterday. And I look around and I think how disappointed I am sometimes in how little support we give our veterans. We ask them to go do unthinkable things with very little support. And then when they get home, they're just kind of thrown back to the wolves. And then we wonder why there are these mental health issues. And then to compound it, we don't talk about them. So, we're going to work, that worry and anxiety piece then gets amped up because we're just not talking about it. And I think that the temptation is to think like, oh, we're not talking, if it's not being talked about, it's not happening. And that's not it at all. And that's probably partially illustrative of that alarming suicide statistic, unfortunately.
Yeah. I think that, that mentality for men, like, don't talk about your feelings, boys don't cry. Those types of things are having an effect on men.
Yep.
And telling them that boys don't cry. You know what? Boys do cry, and girls cry, and everybody cries, and they need
Everybody
to have that
cries.
outlet. Everybody cries,
Yeah.
and they have to have that outlet because crying your emotions, that is an outlet that kind of makes you just feel better. Sometimes you just need a good cry, right? You just need to like get it
I think I was
out.
in my late 20s before I ever really truly connected with the idea that the release of tears is the actual release of like negative energy. And that's really freeing thing at raising, as a mom raising a young boy.
Mhm.
Absolutely. That we do not say boys don't cry. Everybody cries. It's to
Yes.
cry, to be human is to cry. So yeah, I'm all about changing that stigma, and again, opening up an outlet for men to have an easier time of getting their mental health addressed.
Yeah, and I think it starts especially when they're younger. Like you said, you're raising a boy, and I think it starts younger. And sitting in a counseling office, um, most of the teens or children coming in, majority of them are girls, young women who are coming in to talk about their feelings and talk about things they're going through. And I think about like, yeah, I mean, like I know they need to get it out, but so do boys. And where does that fall? Like, do parent are they recognizing some of the things that are happening to them? Do girls come home and they say, "Oh, the girls they were mean girls, right? They were mean girls and they were being mean to me." But
That's what they
boys
say.
don't really.
Boys don't say anything. Yeah.
They don't say anything. They don't say, "I've been bullied, I've been shoved in, to the side of a locker, I've been, humiliated," talked about whatever. They're gonna hide it and they're gonna keep it
Yep.
to themselves, and
Yep.
that's gonna build up, and I think that that's a big issue for sure. And so, young men also need to have being able to go to someone and it be a safe space
Yeah.
to talk
And
about
like,
feelings, to talk about anything. That's where I have a problem with some of the, public schools. And as you know, I live in Florida. So, there's a lot of things that you can't talk about in schools. But sometimes the boys, they need to have someone to go to and talk to and not be, I have to tell your parent this.
right.
No, no. That sometimes they just need someone to, unless it's a safety issue, they should be able to have a trusted person to go to. And when my daughter started counseling, that was what they told me. They're like, we're not gonna tell you what we talk about unless there's an
The safety
emergency or
concern.
it's gonna be
Yeah.
self. Yeah, exactly. And that needs to happen with boys at school.
Yeah. Well, that's like feeling safe piece is, I think, so
Mhm.
often underplayed. But, you know, I try to I try to teach my son to have these check-ins with himself, to normalize some of his feelings and say like, How do you really feel about this issue? It's okay to be mad, sad, upset, angry, jealous, whatever, right? Like, so let's take inventory of our feelings. And then, as you mentioned, like having a trusted person, having somebody to be able to be like, hey, you doing okay? And then for guys, I think that they do have to do, I mean, this is the same for women, but making sleep a priority is really a key. Noticing what drains you versus what restores you. That is something that I waited way too long in life to learn. What are the things that actually restore me? Because it's not a one for one sometimes. The things that you think would sometimes drain a person are actually restorative. So being able to have the self-awareness to say, like, you know what? Because my husband is an introverted, no, he's an extroverted introvert. He can be an extrovert, but he really prefers to be an introvert, right? But he
Yes.
knows that, like, okay, if I have to be an extrovert, that's a little draining. So I need to prepare time for there to be some restoration in there, if you will.
Yeah, absolutely. I can totally get that because that's me too. I'm like, yeah, I can be extroverted, yay! And then I'm like, man, I need to be alone, and I just want to
Yep.
sit in a dark room by
Yep.
myself,
Just
and
leave me
or maybe
alone.
with the
Leave me
dog.
alone
I'm
for a
cool with
minute.
that.
I'm overstimulated. I think is that like
Yeah.
I feel like that is, when you think about like we talk about hormones, I know this is men stuff, but like we're two fertility nurse women, like give us a second. But like I do think that perimenopause is really like a major lens through which all of this is, even for guys, like they don't go through any massive hormone change like we do in terms of it being like taking over your everyday existence. But at the same time, there are things that I think just saying like, yeah, that's like my hormones are messing with me and, like just owning it and not being so self-critical over, I try to tell my young daughter like, yeah, your hormones make you feel crazy sometimes. I know mine do, right? What do we do when we feel that way? Instead of just don't feel that way or don't be
Right.
sad. Don't do this. It's just what makes you truly feel better.
Yeah. So since our episode of menopause, the menopause episode, my husband keeps saying that he has menopause. So he blames everything on menopause now. So
Okay. I think
I
that's totally
probably
fair.
shouldn't
It's
have done that.
can of worms, Movember and menopause.
Yes.
I think that's fair because
Yeah.
there's also man flu, and I think that these things are relatively well interconnected.
Yeah. True,
But
true. True,
that's fair
true.
though, right? I mean, like you said, like we do. 40s is an interesting time in life, and you think back to like when you learned
Mhm.
in nursing about like adolescent, what that phase of life is like versus like middle age. And I remember learning about it as a young person, thinking like, what a drag. And now I'm like, yeah, what a drag.
It is
No,
a drag.
uh,
It is a drag. For
right?
sure.
Sometimes it is, yeah.
Yeah. So I think like as clinicians, especially in fertility, again, we are fertility nurses, so we focus a lot on that. But in the fertility clinic, doctors and nurses, we always are concentrated on the women. Hey, how are you feeling? Are you doing okay? And their mental health during the whole process, because we know how trying and emotional the whole process is. But do we stop to recognize the male partner? Are they feeling depressed? What's been, on your mind that's been heavy on you lately? Kind of helps them open the door, to that honesty. But I think that even not outside of the fertility clinic, primary care, things like that, which I'm not as familiar with, but I would hope that those kind of questions are being presented so that sometimes the guys are just like, yeah, it's hard,
Yeah.
and no one's asked me about it. And, as we all know, fertility isn't just a women's issue. It is, it's both. It's
It
men and
is. And
women.
because like tactically, I guess, I don't know a better way to put it, but like the guy's part in the whole picture of infertility treatment is pretty small, but we have to remember
Mhm.
that because it is small, they and guys need to often like feel this need to fix things. And so
Mhm.
having such a small, at least like perception of control is really, really, really hard because they just want to fix it. They just want to make it better. And so I like that
Yes.
idea of saying something like, what has been heavy for you rather than are you depressed? Because I think, I'm making this statistic up, but I would imagine probably 5 out of 10 guys immediately hear depressed and like, nope. like just instinctively, right?
Mhm.
And so I think also it's important to highlight as we talk about mental health and we talk about the stigma of men's healthcare, but also the LGBTQ plus lens, because queer and trans
Yeah.
men face added stigma and added barriers to mental health and reproductive care. Remember, these folks are literally on a daily basis trying to justify their existence. So add to it discrimination, financial burden, fear of judgment, lack of affirming providers, all of that affects access and outcomes, right? And so
Mhm.
our queer and trans men, I think, are even more at risk of untreated mental health, issues because of these additional barriers. And like I said, can you, I challenge folks to think about, like, can you imagine on a daily basis just having to justify your existence? A lot of those other things are probably going to fall by the wayside if that's your primary fight in a day.
Yeah, I remember having a patient, a trans man that came in because he wanted to preserve fertility, right? So, he came in to do egg retrieval and freeze egg. And, it was a whole I can imagine coming in, you are a man and you're sitting amongst a room full of morning monitoring women, right? And how hard that must be, to just sit there and then, go back for, your morning monitoring and all of that. So, that is, can have an effect on that person. He was great. He was one of my favorite patients because he was just so chill and it
Yeah,
was, he was very pleasant and yeah, we were able to do 2 rounds and we did a whole bunch of egg freezing and it was great. So I'm very happy that he is going to be able to go into the future and potentially have a biological child. So,
absolutely.
gay men that come in, yeah, it's hard because guess what? They don't have an egg, they don't have a uterus, and now we have to tell
Yeah,
them, "Oh, you gotta get both, and this is how much it's gonna cost." And it's very burdensome for for them as well. So, that all takes into effect of having, that mental health and having support there for, our gay men, single gay men, couples, and trans men, mental health support is absolutely needs to be inclusive and every patient deserves a place where they feel safe, seen, and totally understood.
absolutely, without a doubt. I mean, I remember my initial entry into this field, and we've talked about this before, but seeing like husband and wife on the paperwork, I was like, okay, yeah, we need to make some
Yeah.
updates here. But let's get into male infertility because the evidence is really clear. So, a major 2019 review found that global sperm counts have dropped by about half over the last 40 years. Half. So, the global burden of male infertility has increased by about 77% since 1990. That's alarming.
Right?
It's
Yeah.
alarming.
It's quite that yeah. I'm just like, I mean, there are
Sense, and it's where I will give some of our more holistic providers some credit because I think that a lot of this has to do with endotoxins and things that we don't entirely know the impact of, but we know that they play a role. And yet I think sometimes I might get skewered for saying this, but not everything is a randomized controlled trial. If we know that we have our sperm counts have dropped by half over the last 40 years. Let's do something about that. It's not about
Mhm.
blame, it's about finding the root cause. And that's where I say that like some of our more holistic providers would say, well, root cause, root cause. And I would say, yeah, let's actually do that. Because I think, the lifestyle changes are often, we do bring those things up. But I mean that is just to say that male infertility has increased by 77% is it's since 1990 is just that's bonkers. Totally bonkers.
Yeah.
That's a scientific term too,
It
bonkers.
bonkers is a scientific term. Hey,
Today it
I'm all
is.
for it. I'm pretty sure it is. I agree. Just like
Yep.
shenanigans. That is a medical term as well. Yeah.
Especially if there's a
So,
full moon, there will be shenanigans,
absolutely.
always.
Yeah. I can't get over that number, to be honest with you, especially since 1990, and I feel like 1990 was like yesterday, but it wasn't that long ago. I was still in high school, but I was middle of high school at that time, so I just feel like that was not that long ago, but I guess it
Well, to think
was.
about that's actually really fascinating with our ages, right? Because we are right around that time frame where and you think of peak fertility, right, like being in your 20s, um,
Mhm.
to think that in the amount of time that has passed since we were in our 20s, we have increased male infertility by 77%. So, I think it's quite possible to say that even you and I, if we had it to do over again today, might not even have the fertility successes that we did. I mean, I think if I recall correctly, both of your kids were spontaneously conceived, and were a little bit of everything, adoption, yeah, all the things. But I think about what it would be like to be in my mid 20s today, knowing that we're at a 77% increase in infertility issues. I mean, that's 3 out of 4 people that you see. 3 out of 4 men that walk into our clinic doors are going to have some sort of infertility issue. That's
Yeah.
really, really, really alarming.
Yeah, so I think looking at like the different reasons, yeah, and there's so many different things, like you said. It could be environmental, it could be anything. We talked about cardiovascular health, we talked about insulin resistance, we talked about not getting enough sleep, which who does nowadays? That all kind of correlates with semen parameters and these semen analysis that we are seeing now.
Yeah, yeah, absolutely. Well, we brought it up a little bit earlier, but let's talk about testosterone therapy because we do see this. It's very interesting, but we will see guys come in, right? Reproductive age guys, but especially like guys in their 20s and early 30s are much more interested in their physique than the guys in their late 40s and 50s are. That's a bit of a stereotype, but roll with me. And so testosterone therapy often gets introduced, and guys think it boosts their fertility. And
Mhm.
believe it or not, supplemental testosterone actually shuts down sperm production. So clinically, it does the
Mhm.
exact opposite. So sometimes we would have guys come in and or couples come, a male female couple come in, and all you have to do is be like, "Oh, you're taking tea, that's the problem." Like, not necessarily that's the problem, but that's something that's a big fish to go after. That's a piece of low-hanging
Yeah,
fruit, right? So, but
absolutely.
yeah, knowing that and it, again, that's like an education thing because it's the exact opposite of what is the perceived.
I can't tell you how many times I've seen that. They come into the office, we've been trying for so long, and I would go through the person's chart before they would come in, and I already knew what the doctor were going to say. And here's the thing also about testosterone, not only do whoever is giving them the testosterone needs to inform them, and a lot of times they're not being informed of this, and they think everything is all good. Look at me. I got these big muscles. I'm really looking physique wise really good. And yeah, we're going to have a baby, and then they find this out, and it's devastating to both of them. So like what I see, and I'm not saying this happens in all of the cases, but in many times the women get very upset, like that they didn't know. The men are irate because they were never told that this could affect their fertility. And then they learn that they can't just stop taking testosterone. They can't just stop. You have to wean off of it. So then they're like, well, wait, I can't just stop. No, you can't. Your body is going to be in not a good shape if you
Yeah,
just stop your testosterone. You have to wean off of it. Usually, what's like 3 months is again, we try another semen analysis in 3 months and see what we got. I mean, we obviously have them do a semen analysis at when they come in the door and they are on the testosterone just to see kind of where we are. 9 times out of 10, there's nothing there. And then they have to wean off testosterone, wait 3 months, come back. And hey, you know what? I've seen men bounce back and it's all good. So, I don't know if you've seen that as well.
absolutely. It's wild how and that can be such
Hmm.
it's a relief kind of when we're like, okay, we can stop it and things will be better. But
Hmm.
there is a lot of blame and stuff that goes on. And so then I think that it can be a very frustrating moment. And there again, I mean, this should be something that is like really, really, really clearly taught to folks who
Mhm.
elect to undergo some sort of hormone replacement therapy. Is like it seems very basic, unfortunately,
Right.
but it's not.
Yeah. I think there are, there are some bad apples out there that do not go into that. The other thing for testosterone patients that I have done with men who they want to be on it, they come off it, they wean off of it, they wait the 3 months, they do a semen analysis, but then they freeze sperm. So there's that option for men who don't want to be off of the testosterone long term. We have frozen many vials for them so
Yeah,
that their partner can go through IUI, IVF, what have you, and have vials available for them,
yeah.
and then go back on the testosterone.
Yeah, and that's pretty common, right? I mean, we would see that because, especially if you have, it's not highly uncommon to have a couple is not the same age. So
Mhm,
for some couples where there was, a bit of an age gap, and the guy was like, "Wait,
mhm,
I feel great on this. I don't want to have to go off it." And it's like, it's temporary.
absolutely.
Let us bang
Yeah.
some sperm, and then from there you can get back to feeling good, and we'll still have options. So
Yeah, exactly. And so I think that's important that they understand that it's all good. Switching gears a little bit, another thing that I would see a lot men on marijuana, on cannabis. There's a 2020 study that found that cannabis can reduce sperm count, reduce the concentration, hair morphology, lower motility, decrease fertilization potential, and that's not me being judgmental. It's physiology, and I remember my embryologist who one time was looking at a semen analysis, and she had me come in and look at it, and she had me look at the shapes and the morphology of the sperm, and she's like, "This guy's on marijuana. He's doing pot." And I'm like, "Really? How can you tell?" She goes, "Look at all the weird shapes and the elongated heads." She goes, "This is a" Sure enough, when asked, he was on pot.
interesting. Yeah, no, absolutely.
So,
And as you said, it's not judgment. It's it's just physiology. It is that is what happens. There again, I think, there's a lot of stigma around, consumption of marijuana. And I think in many states it's legal. And I think federally it's still, there's issues around it. But there's a lot of different reasons that people might consume cannabis, and it can reduce all those counts, but we can also we can, work towards really good numbers, get some banked. And then, people they ingest marijuana for MS, for, I mean, a million different reasons. And so,
yep.
on that note, lifestyle and environment definitely matter. And this is another one of those public education pieces, like heat exposure. Now, remember, we're talking about our physique, right? We're in our 20s and we're in our 30s. Yeah, right. And be in the sauna, the hot tub, and wear tight underwear. And, I got my heated car seats, and I'm smoking, and I'm not sleeping, and I'm eating like crap. And I'm like, sedentary. Like all of those things unfortunately do affect semen quality. And there again, it
Yep.
sucks because
Yep.
it does feel judgmental oftentimes. And
Mhm.
but it's not. It's physiology.
Yeah. We're just trying to help you.
We're trying to help.
So, talking about men coming into a fertility clinic, so men rarely get, space to express how uncomfortable it can be. So, I have asked a couple of my friends and people that I knew that went through the process, and these are the things that I heard from the men folk. Walking into a fertility clinic and seeing other men. Well, they all know what they're there for. It's like they know what they're gonna do,
Oh, and
right?
they too, that
So,
just it's like the look, right? And it's like,
yeah, it's
I
like,
know and
I know
you
what you're
know.
here for.
Yeah. We're both
Yeah,
here for the same thing, and neither of us wants to be.
exactly. Or the guy that comes in with the little brown paper bag and the sample is inside there. It just can be like kind of weird. And we have to think about things like that. Also men feel pressure to perform, during the sample collection, and it's not just, oh, am I able to provide a sample? It's also worrying about, is the sample going to be good? Are the parameters of
Right.
the sperm going
Is
to be
it
good?
me,
They're
right?
worried about things like, yeah, yeah, exactly. And you know, being in a collection room, depending on where it's located in the clinic, sometimes they while they're in the collecting room, they can hear people talking outside the door, and, like, for you and me that work at a fertility clinic, we don't care. We're like, "Oh, someone's in the collection room." But you know what? Like, not at ease because people are talking out there, like, it's just awkward all around. So
Yeah. No,
that's the thing that we should be more aware of and be more
for
sensitive to.
For sure. We've asked men to do a very emotionally loaded task in a space that's often designed without that comfort in mind. The room matters, the soundproofing matters, the chair matters, the communication before and after matters, right? And just recognizing that, like,
Absolutely.
I get it. This is not fun. I mean, my own husband wanted to make it into a joke, and that's good, right? That's his way of coping. But I remember his semen analysis. I mean, I worked in the clinic, so I had, like, access, right? Thankfully. And so we would allow guys to collect at home and bring the sample
Mhm,
in, because that would be another way to make it more inclusive or make it more tenable of a task, is to say, like, I get it. Not everybody can just walk into this strange place. This is a clinic. We all like it's so collect at home, bring it in, fine. So, I remember driving to work one day with, the brown paper bag, tucked such that it was staying warm. And, so he didn't have to really
mhm.
walk in and do the whole like look. But what he did have to do was meet my boss on collection day, on the retrieval day. He's like, man, the first time, no, this wasn't the first time. He's like, I gotta see your boss and do this in the same day in the same place. Like, this is. So we used to, my husband was very excited because that semen analysis that I did where he collected at home, brought it in. His numbers were awesome, right? And we know that, like, as you mentioned, worrying about what the numbers are going to be is a huge mental part of the process. And so when his numbers came back solid, I mean, he was like high fiving and wanting like a plaque on the wall in the andrology lab. Like, Mark Amos, if you're still listening, Mr. Lee does still expect his plaque. He feels that, Dr. Amos will always say, even Superman himself only has 5% perfect sperms. So, right. But anyway, men, they do though. These having this inclusive reproductive care, that the men want to be included in the conversations. They want things to be explained clearly. They want to know what is morphology versus motility. Why does what one matter right now and another one matters later? What can I do
Right.
about any of these things, and like we talked about the inclusive piece of recognizing same-sex couples and trans men and single parents by choice and all of the different recipe combinations that come into the
Mhm.
clinic, right? And just meeting them with respect and just complete clinical competency. No judgment. No, this is what you should or shouldn't do. You're coming into here with these goals. These are your options. How can I help you? How can I help you make this a
Yep.
reality? Is it freezing sperm or eggs? Is it whatever it is? How can I come to the table with that complete clinical competency and meet you with that respect? And I think that the clinics that really do well in the patient experience space take that into a lot of consideration.
Yeah. They definitely men deserve, emotional supportive care, They
Yeah.
deserve guidance is free of shame. They deserve a partnership in the entire process, including them when they come in for their follow-up, when they come in for the new patient appointment, having, acknowledging them essentially, right? And
Yeah.
bringing them into the conversation because they want to be a part of the conversation more often than not.
Yeah, and taking that like one tiny step further, I've seen this happen not just in the fertility clinic, but like in the pediatric clinic, in the labor and delivery unit, where men are often not really acknowledged. I think of a friend of ours who both of their babies were in the NICU for a long period of time, and I remember the dad telling me how unincluded he felt. Like, he felt like just like a complete afterthought. When we're teaching you how to feed the baby or whatever, just like, oh, hey, who are you? Type of thing. So I think it's as much as women have been left out of many healthcare conversations, so have men. So let's summarize. Heart disease remains the top killer of men, and prevention is powerful. Diabetes, weight, and hormonal balance are all very connected. Mental health is a medical issue with very sometimes severe physical consequences. And male fertility is absolutely real healthcare. and it deserves attention and compassion and the same evidence-based support that we give across the board for other disciplines.
Yeah, and resources are out there that you can find, for example, like the Movember Foundation, Men's Health Network, Resolve, Men Having Babies, all of these organizations, and many, many more. But all of these organizations are there to provide, just information and
Yeah.
opening discussions. So,
Yeah, this Movember, it's still weird to say Movember, I like it. And truly reach out, encourage the men in your life to check in with their bodies and their emotions. And even that, like right there, can sound uncomfortable, but prevention is strength, vulnerability is strength, asking for help is often a strength. And so let's encourage the guys in our lives to have that vulnerable strength. So
absolutely.
that's that.
We're okay. So that we're ending now. I'm Anne Marie.
I am Elizabeth. Thanks for listening to the
Thanks for
Reprofiles. We
listening to
appreciate you all.
Reprofile.
Share, click, like, all the things, and we will be back next week. Pending any crazy news, we'll be back with our next topic. Otherwise, we'll keep you caught up with the news of the day. Until then, we will see you later.